exciting to see.
This meeting is being recorded.
It will be exciting to see where you're based and then to have a lively discussion throughout the next hour that we have planned for this webinar. So feel free to go to Menti and tell us where you are based. Thank you. We will start in about 3 to 5 minutes. For those who are joining us, welcome. And please use Menti, go to Menti and use the code that appears on the screen and let us know where you're joining us from. Wow, thank you so much for joining us today. It's very exciting to see how many people are joining this conversation with two very special guests and how diverse the audience is from different parts of the world, Africa, Europe, North America, Mexico, Central America, and South America. So very great to have you all. And it's a pleasure for us to hold this conversation. This meeting is part of the USAID's Bureau for Humanitarian Assistance Capacity Building Project. As you know, this project supports local international non-governmental organizations that work with USAID to manage pharmaceutical and medical commodities in humanitarian crisis settings. Technical meetings are just one of several capacity building activities that JSI is doing to strengthen capacity in humanitarian assistance context. You may remember that we recently had a moderated discussion on procurement and how to reduce lead times. And also we had a technical discussion similar to the one we're going to have today on prepositioning of supplies to reach out the last mile. So this is one of the series of webinars and technical discussions we will be holding throughout this the next few months. Next slide, please. Today, I'm joined by my colleague, Anabela Sanchez, and also Nadia Olson, who will be providing support to this session. And together, Anabela and myself, we will facilitate this session. So, Anabela, it's a pleasure to have you with us, and please introduce yourself.
Thank you, Nora, and welcome everybody. I am Anabela Sanchez. I am a senior technical advisor and live in Guatemala. So very nice to be in this meeting and talk with you about these very important topics for all of us. Thank you. Back to you, Nora.
Thank you, Anabela. And I'm Nora Quesada. I'm a senior technical advisor at JSI. I have worked in international development for several years, not only in Latin America, but also in Africa and Asia. So it's really a pleasure to be with you. I'm sending greetings from Bogota, Colombia, South America. We're happy to have you all of you with us today and look forward to a very participatory discussion. Next slide, please. Today, we are delighted to, excuse me, we are delighted to have and welcome Rejoice Thomas Kaigama from Nigeria, who knows how critical it is to have medicines to save the lives of malnourished children displaced by conflict in Borno State. So Joyce, it's a pleasure to have you, and please introduce yourself.
Okay, hi everyone. Nice to meet you. My name is Rejoice Kaigama. I'm a licensed and practicing pharmacist based in Borno State, Nigeria. I am a graduate of Ahmadu Bello University, Zaria, in Nigeria, through the Kaduna State. I currently work with INTERSOS as a pharmacy assistant, and also I am the medical logistics forecast person for the stabilization center here in Nigeria. Nice to meet you. Thank you.
Thank you, Rejoice, and it's very nice to have you, as I said, and we are very excited to have you and hear about what you will share with us in the next hour or so. Thank you so much. Next slide, please. We are also very, very happy and honored to have Ayuba Nuhu Tarfa, currently working for MSF Switzerland in Borno State, Nigeria. Welcome, Ayuba, and please introduce yourself.
Thank you, Nora. I am by name Ayuba Nuhu Tarfa, a graduate of pharmacy from University of Maiduguri, Borno State. I'm also an enrolled student of Masters of Science in Global Health Delivery, Rwanda. For the number of years, I've been so engaged in the management of medical and pharmaceutical commodities for INGOs whom have been engaged in activities within northeastern Nigeria. It is a privilege that I serve in the capacity of project pharmacy manager for MSF Swiss, and as well I've worked in various other international INGOs ranging from Save the Children, Alima, INTERSOS, and currently MSF Switzerland. It is a pleasure to be part of this discussion, and I hope and believe that it will be productive. Nice to meet you all.
Thank you, Ayuba. The pleasure is ours, of course, to have such talented and experienced guest speakers with us today. And we are very excited to be here and learn from your experience as well. Thank you so much. Anabela, back to you.
Thank you, Nora. And as we move on in our meeting, we would like to give you a few reminders. Please introduce yourselves to each other by using the chat button. We are going to have a very interactive conversation. Please raise your hand when we are in the conversation with Ayuba and Rejoice. But also you may go ahead and use the Q&A button on your screen. to pose your questions, and we will follow them and try to answer them as many as possible. So we also would like to say that this meeting is possible thanks to the support from the USAID Bureau for Humanitarian Assistance. As Nora said, we are part of a capacity building project that develops curriculum, including country case studies, conduct pharmaceutical and medical supply chain capacity building activities, share learnings with regional and global communities like we are doing today. And we also support organizations in better institutionalize the pharmaceutical management commodity practices. So we are happy to be part of this program. By the way, part of the capacity building activities is the blended learning courses that I'm pretty sure some of you in the audience have been participating, including Ayuba and Rejoice. Both of them have been part of this program. So first of all, let's look at the session objectives of today. We first would like to gain an overview of the supply chain data management for improved performance in humanitarian and emergency situations. We will also review essential data and key performance indicators needed to develop an improvement plan in your organizations. And last, we will also share experiences with the help of Ayuba and Rejoice. We will also share resources and tools that you may use, and we will share later after the webinar to monitor performance of key indicators by applying also team approaches. So a quick content overview is based on these key themes that you see on the screen. During this session, we will try to connect the dots amongst all of them. And we will also look at the essential data of good quality information that needs to be collected in a timely fashion in order to monitor the improvements, the challenges that you are facing, and also especially to analyze what are the bottlenecks and how to resolve them in a team. And we're going to share a few approaches that we have implemented. So I think it is important to also look at the humanitarian response phases, and also say that the logistics cycle is a well-designed system that helps the supply managers to really make sure that the logistics cycle, including the essential data, monitoring progress, is connected and is functioning throughout every phase of the humanitarian assistance, beginning with preparedness phase. As we all know, we need to prepare the processes and organize the teams that will need to roll out certain activities when any crisis hits. In every phase of the humanitarian response, the supply chain manager also needs to know the status of each of these components of the logistics cycle. So now we're gonna pose another question. So get ready with your Menti app, and we will ask you to tell us on the screen which of the following is not an essential supply chain data item. So please go ahead and start answering this question, which is part of what we will cover today. Great. We see that everybody is answering, and we will see if that is the correct answer. Thank you, everybody. Great, thank you for your participation. Some people say consumption data is not an essential data. 25 have responded that issues data is not part of the essential, very essential data on supply chain. Great, thank you for your responses. Yeah, answers continue popping in, but I think most of you are saying that issues data is not an essential supply chain data. So we're gonna continue, and we're gonna review that the three essential data for the management of the supply chain are three. The first one is the stock on hand, and we say stock on hand usable, and that means that we count only the products that have sufficient expiration date that are not expired. The second essential data is consumption, which is basically the products that are dispensed to the patients and to the users during a particular period of time. And the third one is losses and adjustments. Other data is absolutely necessary as well, but most of the indicators that we are going to look at today can be constructed basically with these three indicators, and we're gonna share with you also this information that comes from the logistics handbook of the USAID Deliver project. Some of the key performance indicators that you see on the screen are basically necessary to monitor the availability of products during an emergency, during a protected phase, or when we are already recovering from a crisis. So there are other indicators that you may use, but we think that these indicators on the screen are some of the most easy to monitor and based on the essential data that we have mentioned. We can say stock status is very important, and that is based on average monthly consumption, stock on hand, inventory accuracy, how well and matched the inventory count with your records that you have in your pharmacy and in your warehouse. And the reporting rates, of course, we cannot monitor information if we don't receive on a timely fashion the reportings from lower levels of your distribution system. So lastly, we would like to mention that there, as you may do in your organizations, teamwork is essential for all the aspects of the supply chain. And there are many approaches, but in our experience, we think that using this approach of, we call it impact team, which stands for information mobilized for performance analysis and continuous transformation. And I think transformation is the best part of this approach, because we try to form a team that will collaborate, communicate, and coordinate, always thinking that there's always room for transforming and improving the work that we'll do in supply chain management of pharmaceuticals. We also can do an action plan together, and especially continuously monitor the performance, especially the availability of products in the last mile, where for example, Rejoice will tell us later in the pharmacy that she manages. And the other aspect of this approach is recognition. We always try to identify problems and bottlenecks, but we also need to applaud when there is progress. And the way we do it is that we monitor some of these indicators that we showed before. So before we start the conversation with Rejoice, we're gonna pose the last question for you all, and we will ask you to please answer this question. What is your biggest challenge in getting quality data for key performance indicators for pharmaceutical and medical devices, which is the main theme today? So please go ahead. This is an open question, and we would like to hear from you on these challenges. Delayed reporting, absolutely. The system, incomplete records. Internet connection. Oh yes, that can be difficult when we are, especially when there is a crisis and connectivity is not possible. And as we populate your answers, you will see that the most prominent are, for example, incomplete data. Yes, we have always experienced that difficulty. And how that incomplete data starts at the foundation of any supply chain, which is where the data, the primary data is generated. And we will see some of that based on Rejoice experience. Internet is also popping up as a very important challenge. Yes, thank you. Untrained staff. Communication gap, that's interesting. And as we continue receiving your answers, internet, incomplete data, and delayed reporting are the most prominent. Thank you so much. Thank you for your participation in this interactive discussion, lack of funding as well. But the three major ones are lack of tools also, internet, incomplete data, and delayed reporting. The questions will be still going on. So please continue making your answers, and if we have time, we can review them at the end of our presentations. So Nora, please go ahead. The floor is yours again.
Thank you, Annabella. So, you know, all the technical content that you share sets the stage for the presentation we're about to see from Rejoice. Rejoice will give us an overview of what INTERSOS does in Borno State, specifically in the Maiduguri Stabilization Center, and how they collect, organize, and analyze data to make timely decisions, and how they monitor performance using specific indicators, and how they analyze them through teamwork. So without further ado, Rejoice, the floor is yours. Please unmute, Rejoice. Go ahead, Rejoice.
Maybe she's having connectivity problems.
Yeah, I guess so. Okay, what if we go to Ayuba, if in case to allow Rejoice to reconnect and she can let us know. Rejoice, when you're ready, please send us a message and we will be ready for you. But then we will go to Ayuba and start with several questions that we have for him. Annabella, if we can move to those slides, please.
Okay, let me move quickly to.
Sure, thank you.
Okay.
Okay, so again, I would like to welcome Ayuba to join this discussion and to bring his experience in several organizations that he has been providing support in humanitarian assistance. Ayuba, let me start by asking you the first question. We know that you have gone through a very difficult times trying to resolve supply chain crisis in pharmaceutical and medical supplies. So based on your experience, how important, relevant, and feasible it is to form teams to monitor the performance of pharmaceuticals and medical supplies?
Thank you very much, Nora, for such a wonderful question. For the time being that I've been engaged in the humanitarian intervention in northeastern Nigeria, one thing for sure that is very important and key to achieving the goal of any organization or an institution is to ensure that there is coherence when you talk of the goals, individual goals of the team members. So going by the strategy of the impact teams, it is important to form a team that shares a common goal and a structured approach to problem solving. With team collaboration, communication, and coordination, the performance of the pharmaceutical supply chain becomes easier to monitor. The teams will need to ensure that accurate data is collected, so meaning data from the consultation, from consumption records. After the collection, you compiled and then you review. And where there are problems encountered, the problems are analyzed according to their priority, because you need to prioritize such problems and then address them in a team meeting, which is expected. Like the way I have been so engaged into with my team is every month, at the end of every month, we tend to discuss that. And action plans from the meeting now, the team tends to drive action plans depending on the problems being encountered, depending on the challenges being encountered. Is it a challenge from the data collection? Is it challenge from consumption records? All those things. So when we are able to identify where the problem is, then it is left for us now to have a ping pong, sit down and then discuss with the team and profile solutions. So from those solutions, we draft out our action plans and to address those problems accordingly. By doing so, this tends to improve the quality of the data and as well builds the capacity of the team. And more so of key importance is to prevent what we call the stock out of the pharmaceutical commodities, which is very key. Without those pharmaceutical commodities at the end of the day, the whole essence of the intervention will be defeated. Thank you very much.
Thank you, Ayuba. You know, during the crisis or a difficult situation, it's sometimes people are so busy trying to firefight the problems. How easy it is to bring together people and have this type of discussions? Do you have to be organized in a way that the team always meet on a monthly basis, for example? How feasible is that?
Okay. One thing for sure is during the plan of activity, it is expected that each department is supposed to come up with its own internal chronogram. Chronogram tends to help everybody to be in tab with the phases of activities at each time between each weeks. We tend to define that. Okay, based on that, what happened is for us, being that the coordination is at Maiduguri and we have other activities spread across other LGAs, what normally happens, the meeting tends to happen according to the chronogram. We tend to organize like this team meeting now that we're having. We organize such a meeting at the end of every month where everybody comes up with his own problem, and then we tend to put all those challenges together in a slide, and then there's someone who is there to present, and then we discuss bilaterally on how those challenges should be addressed. So the chronogram keeps everybody in tab with which activity is supposed to happen at what time and for how long.
Great, great. Thank you so much for stressing the fact that the chronogram is very important. So now let's hear what Rejoice experiences now that she's ready. So Annabella, if we can go back to the Rejoice's slides, please. And Rejoice, please let us know if your mic is working now.
Okay. Hi, everyone.
Hi,
Nice to meet you.
welcome. Go ahead, Rejoice.
Thank you. I apologize earlier for I had a little technical problem.
Don't worry, go ahead. We can hear you well now.
Okay. Okay. Thank you, everyone. Thank you for the opportunity given to me to speak on this platform. I really appreciate. Okay. Well, I will start with the overview of INTERSOS activities in Borno State. INTERSOS is humanitarian organization. It has its headquarters at Abuja State, Nigeria, and it has its activities in Borno State, likewise Adamawa State. But in Borno State, where I work, INTERSOS work in several local government areas in Borno State, like Banki, Magumeri, also the state capital, Maiduguri. It also has its activities in Gala, Bama, Damasak, Mongono, amongst others. So in the activities that INTERSOS provides, first, it provides health activities in association with the malnutrition activities in the stabilization center here in Maiduguri and Magumeri, then others in Bama, Gala, and Dikwa. Specifically, the stabilization center is located in Magumeri and Maiduguri, but the malnutrition screening services that take place in Bama, Gala, and Dikwa are referral cases that are being sent to the Maiduguri and Magumeri stabilization centers. Then the therapeutic outpatient programs also take place in Bama and Magumeri. These where we treat severe acute malnutrition with or without complications. Also, it has a camp management and camp coordination activities in the refugee camps of Banki, Gala, Mongono, and Mobile. It also carries out food distribution activities in Magumeri, Damasak, Banki, and Gala. Then also gender-based violence prevention campaigns in Mongono, Magumeri, Bama, and Gala. Okay, so I would like to talk on the relationship between refugee camps and INTERSOS activities. In these local government areas where I indicated in the slide, we have refugee camps in these specific areas. Okay, INTERSOS has its staff in these local government areas where they provide all these 5 activities that I listed. But then for the malnutrition activities, we have these outpatient therapeutic programs that are being carried out where the staff tend to screen children to fish out whether they have malnutrition case or they are well nourished by the parent. So if they're able to pick out a malnourished child, in that particular refugee camp, they send it as a referral to the stabilization center in Maiduguri. But in Magumeri, the staff that are located in Magumeri, when they are able to pick out a malnourished child, they send the referral to the stabilization center in Magumeri, except if they are not able to tackle that particular condition. Let's say the condition is above their capacity, they then send the child to the stabilization center in Maiduguri, where the child will be managed and be stabilized. Then the child will be sent back to the refugee camp where he came from, so that he will be further managed for full recovery, because we have staff that tend to carry out malnutrition activities in those refugee camps. So this is an overview of the INTERSOS activities in Borno State. Next slide, please. Okay, so the photo that we are seeing is the photo of the Maiduguri Stabilization Center. It's located in the State Specialist Hospital in Borno State. So we have a number of personnel that work here, because since it's hospital related, we have doctors, we have the nurses, we have a pharmacist, the medical laboratory scientists, the feeding assistants as well. So other staff that are not medical related are the hygiene personnel, we have the cleaners. We all work hand in hand for the smooth running of the facility, because you know, the stabilization center can't be run by one person alone. The doctors provide consultations, the nurses, they dispense, they serve the medications, they also manage the patients, since it's a 24-hour program that we run. It's a 24-hour program that we run at the stabilization center. The pharmacists provide drugs, the medical laboratory scientists takes care of the laboratory activities that are being carried out. The feeding assistants serve milk, Rezoma to the patients that are on bed. So that's what stabilization center does. Next slide. Okay, at the stabilization center, we keep pharmaceuticals at the pharmacy, which are so specific to the facility, because it's not all drugs that are being kept at the pharmacy. We keep antibiotics, we keep consumables, we keep medical equipment like the blood glucose equipment, the blood pressure machine that we keep, the weighing scale, because we deal with children, we need to know their weight. We also keep the laboratory kits like the blood glucose strips, we have malaria strips. We also keep drugs that are meant for external uses. Then we keep therapeutic feeds, that's nutrition commodities like the RUTF we see in the photo, the second photo, ready to use therapeutic foods. Then we have the F100 milk and the F75 milk. This is meant for the phase 1 and phase 2 management of malnutrition cases in the stabilization center. We also have the LMIS forms that we use for supply chain management. The essential data, as we saw in the slide Annabella taught, we have the consumption data that we use. Then we have the stock on hand and the losses and adjustment. These are the essential data that we use. The indicators that are meant to make sure that drugs are available at the pharmacy, so we don't run out of stock of drugs, are the average monthly consumptions, the lead time, the safety stock that we use, the fiscal inventory, and the review periods. These are tools that are meant to make sure that drugs are available always at the pharmacy, so we don't run out of stock. Next slide, please. For the effective running of the pharmacy, we are supposed to make sure that there is effective flow of data from one unit to the other in the facility, so that there will be improved performance monitoring of the stabilization center. What we do, first of all, since the nurses are the ones that serve medications, we have a drug daily tally sheet where we record the quantities of drugs that we give to the patients per day. Then we collect the data every day from the wards. That's we collect the daily drug tally sheet that be recorded every day. We collect data from the medical laboratory scientist too, since he takes care of the laboratory items. We collect data also from the feeding assistants because they take care of the milk and the RUTF and Resomal that they keep and serve to the patients. Then the doctors take care of since they do the consultations, they take care of the data, the number of patients we see in the day, the number of patients that are being discharged. This gives us an overview of the number of patients we have and the quantity of drugs we are supposed to have at the facility, the quantity of drugs we are supposed to request for the next season, so we don't run out of stock. And in this number of patients that we do keep record of, it gives us an overview of the forecasting and procurement also. Since we send report to the pharmacy manager, we send report to the medical activity managers, to which these reports are being taken to the medical coordinator too. So in the collect and organize data, the nurses do, clinic supervisors too, medical laboratory scientists, feeding assistant, and the pharmacists take care of the data. Then we report monthly, we analyze monthly too. Next slide. Okay, and the photo that we are seeing is a photo of the pharmacy with the drugs we keep. As I said earlier, the pharmacy, we collect data, organize, and keep the logistics data to make an informed decision. This informed decision is meant for the next season. What we do this month, after we've collected the data for the month, we tend to analyze it as a team with the nurses and the clinic supervisor and other staff. We see what are we lacking, what do we need to improve for next season. Is there any condition that needs a particular drug for it to be treated? Okay, let's see. Initially, we don't used to keep diazepam injection, let's say, but because we have a seizure case of a patient, since not all patients present with seizures in malnutrition, so we have a seizure case. Okay, we need diazepam. What are the strategies we need to put in place to make sure that diazepam is available for next month in case we have another patient that comes with such a condition? Okay, we have a patient that has this condition. What do we need to do to get this drug as soon as possible, because it's an emergency case? So these are the analysis we do to make an informed decision. So as I said earlier, it's a teamwork activity. So we monitor the movement of medications and nutrition products within the facility. Next slide, please. Okay. So the photo that we are seeing is an example of our weekly consumption tool that we use. The location, we enter the location stabilization center, Medugui, the drug names that we have, the expiration, the unit as tablet or ampoule. Then we have the record. We do record it per day, as we can see in the slide. Then at the end of the week, it will be summed up. So this shows the quantity of pharmaceuticals we consume at the end of the week. Then we use that particular quantity that we consume at the end of the week to be the starting stock for the next week, which at the end of the month, it will accumulate to be a monthly consumption for the facility. So the number of tools we use are quite many. We have the daily drug tally sheet, which we use for our daily consumptions. The daily drug tally sheet is meant for the stabilization center, while the daily drug register is meant for the field consumptions, like in Magumeri and Bama. That's what they use. But for stabilization center, Medugui specifically, we use the daily drug tally sheet. Since it's a 24-hour run facility, you are not supposed to see one person working from morning till night. So that's why we use the daily drug tally sheet, so that if those that work for day are done, those for the night too, we have a particular daily drug tally sheet that they use. So at the end of the day, it will be matched and it will be summed up to give the daily drug consumption. We have a bin card, that's the stock card for entering the quantities of drugs brought and taking orders for transactions. The packing list that are being sent to us whenever we request drugs from the pharmacy warehouse. We have our inventory sheet whenever we carry our inventory. Every month, in the middle of the month, we carry our inventory to check for any discrepancy between the physical stock and the theoretical stock. And we also use this inventory for whenever we want to place a medical order for the next month. So this gives us an overview of the quantity of drug we have in the store. So, excuse me, so we can place the order. Is it that we need more of these drugs or less of these drugs, so as to avoid overstocking and understocking, and also to take out any sleeping stock that we have at the pharmacy. We have our emergency order form. We use the emergency order form whenever we are almost running out of stock of a medication. Yes, so as not to run completely out of stock of that particular medication. So that's what we use the emergency order form for. Then the requisition issue receipt voucher is what we use to place a medical emergency order. I mean, what we use to place our monthly requisitions, sorry. Then the weekly consumption too and the monthly consumption too. And as you know, the pharmacy is like a store. We need to take care of the temperature and the humidity. So we have a temperature and humidity chart. Then the donation and loan certificate. Sometimes other organizations do send drugs to us or medical supplies. So we or we send out some items too for some locations. So we have this donation and loan certificate to tackle that particular issue. So at the end of the day, we archive our forms. We also have an electronic version of it, so as to make sure that storage is kept intact. So that's basically what the LMIS tools are. Next slide, please. Okay, so from my experience at the stabilization center, since it's I would say it's an emergency case because malnutrition is an emergency case. If you don't tackle it at the spot, the patient might pack. So we are supposed to make sure that at the pharmacy, we don't have stock out of drugs. The performance monitor at the pharmacy is to prevent stock out. That's the pivot plan for the performance monitoring. And also we need to make sure that we avoid overstocking of drugs so as to avoid expiration and wastage. And also we need to make sure that we don't have sleeping stock. That's drugs that are not important. We are not supposed to keep it at the facility. So the essence of having a team can never be overemphasized, because when you have a team, as it's been said, 2 heads are better than one. It will help you to analyze your data and to be able to focus drugs that are meant to be brought to the pharmacy for the next month. And also it helps in a smooth running of the facility. That's all. Thank you.
Thank you, Rejoice. I think that after listening to your presentation, I can tell that when we talk about essential data and keeping things organized, having the records, the appropriate records to collect that primary data, which is usually collected at the facility level, it helps build a system where you will have the essential data available throughout the supply chain. Also, it was evident that the way you keep organized your stock and your supplies contributes to organizing the information as well, and reporting and analyzing the reports on a monthly basis. So thank you so much for sharing all this interesting information. So I would like to go back to Ayuba and continue the conversation with both of you. Ayuba, which indicators do you think are crucial to monitoring performance and ensuring the availability of supply? Rejoice couldn't show her slide, but they, in the case of her destabilization center, she keeps track of stock outs and expiry products. So what other indicators do you think are crucial to monitor performance, to monitoring performance of the supply chain?
Yeah, thank you very much for your question. For sure, in the key performance indicators are very crucial in the monitoring of the performance, general performance of the pharmaceutical supply chain management. And the crucial ones would be talking about the on-time delivery by suppliers. For instance, when there is graduation from the preparedness phase to acute phase, definitely there are engagement of local vendors. So in such situation, where you now engage local vendors, the delivery time plays a vital role, because once there is delay in the lead time, it ends up being you end up running the program into stock out, and at the end of the day, it will affect the general performance and what is expected of you. Aside that, also we talk of the inventory accuracy, because when you're going to place your monthly or requisition or even international order or local procurement, your stock on hand, talking about the stock status of what you have that's performing the inventory, it plays a vital role, because when the data of the inventory is wrong, at the end of the day, there are two things are involved. Is either you end up having a stock overstock or understocking. So that will also hamper on the activity. Not just that, also timely reporting by the field staffs, because at the end of the day, if they're busy doing work, you're doing work, and then your reports is not documented, is not on time, at the end of the day, it will not show for it. So the only way to show that the team is working is when they are able to send this report as at when due. So that is more reason why sticking to the chronogram of the program or of the project is very key, because the chronogram tends to tell you at what time you're supposed to do what, at which time you're supposed to do by who. That will also help you and guide you on how to manage your time effectively. Not just that, also talking about stock status, that's stock on hand, and as well frequency of stock out. That also is a very crucial information that needs to be used to monitor the performance of the supply chain management, because once you are always experiencing stock out, then it means your performance is poor. So you need to go back to the drawing board to find out where the problem is coming from and what action plan are you going to put in place to address such a concern. So basically, those are the crucial key performance indicators that needs to be in place in order to ensure that the performance of the pharmaceutical supply chain is being monitored well. Thank you.
Yeah, thank you. Very, very, very useful suggestions that you have provided in terms of what indicators. Of course, there are many, many more, and it depends on what you're trying to monitor and what works best for your organization. So thank you so much. So I have a couple of more questions. And in your experience, what has been your major supply chain challenge for you during a crisis? Because in the middle of a crisis, it's very difficult to think clearly, I would say, unless you are well prepared to face the crisis. And that's when you were talking about having a chronogram, when you were talking about learning from previous crisis experiences so that you can incorporate that into your plan. In your case, what has been a major challenge during a crisis, and how monitoring the supply chain the way you just described contributed to resolving the issue?
Okay, thank you very much, Nora. In my experience as a pharmacist working for the pharmaceutical supply chain management, one of the key and the crucial challenge I have faced so far was working with a staff, understaffing. So the human resource, that has been a great challenge, because at the end of the day, when you have the technical know-how, but you don't have those to transmit or transfer those knowledge down to those that will be implementing the activities are nowhere to be found. Those with also technical know-how are nowhere to be found. At the end of the day, whatsoever you're doing, you're going to overwork yourself until you crash. Sorry to use this word. But so far, so good. In my previous organization, that was the key challenge I faced, because at the end of the day, you end up seeing poor data collection and even the compilation data being shared that are lacking accuracy. And once the data that you're receiving is lacking accuracy, then believe you me, any forecasting you're making, any order you're making, at the end of the day is flawed because those data are inaccurate, and the decision making at the end of the day might be wrong. So that has affected greatly because it can result to stock out, it can result to inaccurate inventory reports, delay also in report sendings. All these things played a role due to understaffing. So one of the key things I believe I learned from the blended learning course was the issue of how to address risk management. And I believe with this, that posed a great threat to even the pharmacy activities. So I liaised with the management in place, try to let them understand the dangers and the challenges that we are being faced with. The management was able to support me, and we're able to recruit 5 competent pharmacists for various locations. And those pharmacists helped in the supply chain processes. And we were able to introduce other tools that will support in the data collection, compilation, and also review. 4 out of these staff that were recruited were also fortunate to be part of the second batch of the blended course learning, which was supported, was anchored by her able self, Barbara Lanfair, and your able team. So that also played a vital role because at the end of the day, with the knowledge we have all acquired, it helped us in how to manage, how to solve those challenges, how to draft out action plans and put them into action. So that plays a vital role, and we were able to know those key performance indicators that we are supposed to put in place when a supplier is supposed to supply an item, when we are supposed to carry out inventory, when the team is supposed to share reports. All these things, they were able to become our checkmates. They were our checklists. It was what we used to ensure that we align with the bigger picture of the organization, such that the suffering of the most vulnerables are addressed medically. So that way we were able to address
Well, thank you so much. I think that you have summarized a lot of the things we usually emphasize when you're working in humanitarian settings, and how to face.
Thank you so much. I think that you have summarized a lot of the
so there is,
we usually
can you mute yourself?
emphasize.
Thank you. Okay, so before we close, and I know that there has been a lot of exchange, changing ideas in the chat and also in the Q&A. My colleagues have been responding to the different questions. And the last question for you, Ayuba. In which phase of the humanitarian crisis is more critical, but also more feasible to monitor key supply chain management indicators? Ayuba? I think we lost Ayuba. Yeah, okay, so let's
Maybe
move on to the closing, because we know that we are getting close to the end of this discussion. I would like to thank both Ayuba and Rejoice for their contributions and participation in this webinar. Before we close, we would like to share some ideas for action plan. Basically to do a quick assessment of the major barriers that you have to improve data for use in decision making, also to develop a supply chain management performance plan and KPIs, the key performance indicators, as I have pointed out, as well as Rejoice, the importance of having a quality, timely, complete data to be able to build these key performance indicators. Also, consider adapting current team meetings, not necessarily creating new ones, in order to analyze the data that you collect on a monthly basis. Very important to take into account to have a chronogram, as Ayuba mentioned, and also to have all the data organized and analyzed in a timely manner, so that this data is available at all times by the whole team who participates in the management of the supply chain. Next slide, please. We wanted to share a template, a suggested template that you can use to develop a performance plan based on identifying challenges, indicators, of course, taking into account a baseline and what target you want to set for a specific period of time. We suggest you do it for 2 years to begin with, and identify indicators, of course, and also develop a plan to monitor performance and improvements in the performance, and also, as Annabella pointed out, to recognize the progress, not only the problems, but also the progress made by the staff. That will motivate the staff to continue improving the management of the supply chain. Some of the resources that we wanted to share is the indicators, the different indicators that you can use to monitor the management of your supply chain. And the next slide, please. And some of the resources that you can tap into to learn more about this topic of performance improvement and the use of key performance indicators. Also, I wanted to remind you all that if you attend all of our series of webinars and discussions, at the end of the year, we will issue a certificate of completion of all the series of webinars and discussions that we are organizing under the USAID's BHA project. So on behalf of my colleagues at JSI and USAID BHA, I wanted to thank you for attending this webinar, and hope to see you all in the next event. So take care. Good evening, good afternoon, good morning for all of you. Thank you so much. See you next time.